Hello, I'm Wendy Terrell from Platform Q Health Education, and I'm joined today by Jennifer Saggio from Children's Hospital of Philadelphia. We're here to share an overview of the scientific poster on nursing education and pediatric neuroblastoma that we would have presented on May 2nd at the Oncology Nursing Society Annual Congress in San Antonio. We're happy to have the opportunity to share this information with you, even if not in person. And the poster is also available for your download.
Our poster was entitled Learning Outcomes on Nursing Care for Pediatric Patients with High-Risk Neuroblastoma. And really our goal here was to provide nurses with the ability to provide the holistic care of their patients and families. We wanted to have nursing be able to address the family's need for education over time, support the families as they develop additional needs, so whether those needs are emotional, social, or financial. The program was divided into 3 different presentations, one in 2016, then in 2017, and then in 2018. And initially, we were focusing on the disease itself, so the diagnosis and the management of patients with neuroblastoma. And then we build upon that program by providing nurses with support in nursing care for pediatric patients with neuroblastoma. And subsequently, our next program was supportive care for patients with neuroblastoma and focusing on nursing practice strategies with a bit of a focus on immunotherapy. So we were able to provide information about the disease, supportive care of patients with neuroblastoma, and looking a little bit on parental decision-making, so how that evolves over time. And also we talked about immediate effects of treatment, late effects of treatment, and we really wanted to be able to empower nurses to communicate with their patients and family over time and be able to support their patients through this journey.
Great. Our educational evaluation approach was survey-based. So we had a pre-test survey, and then immediately after the education, a post-test survey, followed by a 2-month follow-up survey as well. We had 3.4 thousand learners in the program, including almost 2,000 target audience members. And the main focus was, of course, nursing education. And we had a high level of engagement in the program, including over 1,000 polling responses over the 3 years.
What you see here are is that 74% of the learners reported at the 2-month time period that this did have a positive impact on their clinical practice. And you see some of the write-ins that the learners provided us with. And the themes were their knowledge and confidence. We were able to boost that and help them in their care of patients. And also when looking at multidisciplinary care, one response was that they have been more integrated with the social team members as the condition impacts the family's whole life. Additionally, at the 2-month time period, we saw that 67% of the respondents reported that the activity had a positive impact on the patient experience and on the patient outcome. So on the theme of patient outcomes, a nurse wrote in that the patient's comfort has improved. So we were able to provide the nurse with some tools to help with some comfort management. And regarding the theme of communication, respondents said that they were able to educate patients with what they were going to see with each course. So we were able to meet those needs.
Okay. Oh, it's okay. Okay, so we had some knowledge questions that were asked at 3 points in time over the 3 years of programming. And out of the 20 knowledge questions, and some were case-based competence questions as well, 15 out of those 20 showed statistically significant improvements. So, we did see a nice uptick in knowledge and competence as a result of exposure to the education.
So next steps regarding education. So we were able to see with the responses of the questions that this program that was tailored to nursing care strategies could significantly improve the knowledge and competence in pediatric neuroblastoma management, including that post-consolidation treatment, side effect management, and supportive care strategies. Some needs still exist in education on novel neuroblastoma treatment regimens, and this will always continue to be a need as our treatments evolve. And also on communication strategies with patients, with families and caregivers was seen as another need. And so we want to thank you for listening to us today and talking about our project, and thanks.